specific, Minister, and it's to ask you for plans to extend the validity of the digital COVID certificate to 9 months for persons who have recovered from COVID-19 infection, particularly in view of HIQA's recommendation that the period of presumptive protective immunity following infection with COVID-19 should remain at 9 months post-infection. Thank you.
Thank you very much for the question, Deputy. Can I just check we're moving on from Deputy Kenny's
Deputy
question?
Kenny isn't here.
No problem. Thank you very much, Chair. Deputy, thank you very much for the question. And for many people, they do look at this and they say, is this consistent? Because what we have with the EU COVID certificate is a recognised recovery period of 9 months. And as you quite rightly say, we have recent advice from HIQA, which has been endorsed by NEFIT, saying that the presumptive period is 9 months. And so a very reasonable question saying, why don't we just adjust the COVID certificate accordingly? So the EU digital COVID certificate regulations, they create a framework for the issuing, authentication and validity of certificates to facilitate free and safe movement across the EU during the pandemic. Certificates are proof that a person has been vaccinated against COVID-19, has received a negative test result, or has recovered from COVID-19. The initiative has been adopted by countries around the world, confirming its status as a robust international standard for COVID certification. To date, 24 third countries have joined the initiative and a further 32 are in the process of joining it. And this really demonstrates how Europe can set global standards through a decisive and coordinated action. The Irish government has successfully delivered EU digital COVID certificates to the Irish public. To date, 4.5 million, or over 4.5 million certificates have issued nationally, and over 25,000 to the Irish diaspora, which is very welcome. And across the EU, Deputy, 600 million certificates have been issued. The wide implementation for accessing indoor hospitality and services has supported the reopening of our economy and of our society nationally. Obviously, and the scope and parameters for issuing the certificate, really to the core of your question, Deputy, has been agreed at an EU level, and it is standardised to allow for complete operability internationally. So currently, the agreed maximum validity date for recovery certificates is 180 days after the date of the of a positive PCR test, as set out in EU regulations.
Minister, you know, we put down questions for answers, and the question is very specific. Do you plan to extend it? And the reason I had to do it this way, because I failed to get an answer up to now. I know you're extremely busy, but this is a very specific net issue, and we're looking at HIQA's report, and we're looking at a letter to you by Dr. Tony Houlihan on the 11th of November, and I believe there was a previous one, and he sets out that paragraph based on the advice provided by HIQA, which I've already read out. The NEFIT further accepted that HIQA's advice that communication programmes should so on. So they set out that the NEFIT endorsed the recommendation. NEFIT endorsed the recommendation that the period of presumptive protective immunity following infection with COVID should remain at 9 months post-infection at this time. Now, can you just deal with that for me? Because I've been obliged to bring you a question. I have somebody who had COVID, and as we all have had, and 6 months, and then I see NEFIT endorsing HIQA for 9 months. You're telling me what, please? Thank you.
Thanks, Deputy. I'm telling you that the standard is set at an EU level, and whilst HIQA has made its recommendations endorsed by NEFIT, it's an EU regulation which is 6 months, and I'm advised that the EU is not actively considering reviewing that 6-month period at this time.
Direct me to that regulation, because I haven't seen it, and that's my own fault, I suppose, if the regulation is there. If you have that at hand, you might just quote that regulation, when it was brought in, when it became effective, and who have you been advised by that the regulation is going to stand and not be changed? Who's making that advice? All of the time we're endorsing NEFIT and endorsing HIQA, and we go by and large by the reports, by and large. Why are we ignoring it on this occasion? What evidence is there that has led the Commission to say 6 months? Can you point me to that scientific evidence and all of that? Now, there's a question tabled, so I would have expected that answer, not necessarily from you, Minister, but through you, from the department, who have all the expertise at their fingertips, and now we're going to ignore NEFIT when it suits us, we're going to ignore HIQA when it suits us, we'll talk about a regulation that I don't know about, and no scientific evidence whatsoever. Now, it goes to the basis and the heart of trust when I go out into the community that I can instil trust in the system. Garmagat.
Thank you very much, Deputy. Your question, to be clear, says to ask the Minister for Health his plans to extend the validity of the digital COVID certificate to 9 months. And I am answering that directly. What I'm saying is that the digital COVID certificate is an EU set regulation. That's right. It's not being considered at an EU level at this point. But of course, I will ask the department to provide the deputy with a detailed briefing on the EU regulation concern.
And the advice you've referred to. The advice you've said you've been advised that they're not going to change it at this point. Sorry, I'm breaking the rule.
Okay, no, it's no problem. It's no problem at all, Deputy. So the advice I have is from the department who engage with the EU.
You might get back to me on that.
Yeah, sure.
Thank you. Thank you, Chair.
I will.